For joining us on the news briefing for this Wednesday. We have a little bit of a shortened briefing today, and so we'll go ahead and get started. This is the final month for applications for the County of Monterey's Funeral and Burial Assistance Program, which helps provide and reimburse for funeral costs for people who died of COVID-19, but who may not have qualified for FEMA assistance. The program ends October 1st, and we really want to make sure people who need the assistance are aware that they can apply and be eligible. So that is why we have Daniel Gonzales. He is with our Department of Emergency Management, and he is going to share with us information about the program. This is the final month of the program. And then, Daniel, we may have people who wish responses in Spanish, and hopefully you can do that as well. Thanks for joining us.
Good afternoon, everybody. As Maya indicated, we have been running this program since end of October of 2022. This is a program that is meant to provide assistance to Monterey County residents that don't qualify under the FEMA Funeral Assistance Program, essentially due to immigration status or eligibility status that FEMA requires for residents to apply for this type of assistance. So it is a program that is meant to support the undocumented residents living in Monterey County that incurred in expenses during the COVID pandemic from January 20th, 2021 to date. And so we're going to be ending this program on October 1st. And we have been doing a tremendous amount of outreach with really to make sure that residents are well informed and connected to the resource. And we're really looking forward to spread the word through these press briefings and through all the other outreach efforts that we've been going through in the community to make sure that people are informed and understand what they need to do to connect to these resources. If anybody has any questions, I think now would be the time.
Daniel, could you also explain how people find out if they're eligible? What should they do? Not everyone thinks
Missed that little bit, huh?
So, and I know you've got some graphics. I'm searching for them right now. I'll pull them up while you're talking.
Yes. So for people to be eligible to get this resource, the decedent. The decedent needed to pass away from COVID-19, and we need a death certificate that indicates that the cause of death is related to COVID-19. The decedent needs to be a resident of Monterey County at the time of death. The applicant also is required to be a Monterey County resident at the time of the decedent's passing. We need receipts and bills that have the name of the person and the service. Excuse me, let me. Sorry about that. I had the phone ringing. We need the receipts and information that connect the expenses to the decedent. And let me. I am also here. We go. I'm going to pull up right now the.
I've got a graphic up for you. Do you want me to stop sharing?
No, I think this is pretty clear. So we need people to be low income, incurred expenses, like I just mentioned, from COVID-19. It was January 20th from 2020. We don't need citizenship status. You could be undocumented, and you need to be ineligible for the FEMA COVID-19 assistance. So you can provide documentation to show that you're low income if you have social services, if you have a pay stub, all of that information we require. So what we do is we have this phone number that we provide residents with. We could also connect them through our website to this number, and we address each individual and go through a list of questions where we assess eligibility. And that's how we determine if a person is eligible or not. And so, of course, the biggest hurdle that we've had to kind of tackle is people's understanding of whether they can apply or not, or if their information will be utilized for any other purposes So we are really trying to make sure that we communicate who this program is for. And so we are trying to invite people to apply, especially people that wouldn't qualify otherwise for the FEMA program. If somebody calls us and they qualify for FEMA, we'll refer them directly to the FEMA program so that they can get connected to the resources. And we're really trying to make this an easy process for the residents to be able to connect. So far we've had a certain number of residents that have applied, but unfortunately we haven't been able to provide any assistance because most of the people that are calling qualify for the FEMA assistance. So we're really trying to invite those and push for those residents that have those expenses, that have a way of connecting to the resource that can show that they spent this money on the decedent, on the funeral services, so that we can provide them the assistance. They can receive up to $9,000, which is similar to it essentially mirrors the FEMA program. FEMA has a cap of under one application you can also submit different decedents, so you can up to $35,000, but it's $9,000 per decedent up to $35,000. Our program mirrors that, so if somebody experienced several deaths in the family, they can also apply for those additional deaths. And of course, one of the main things we do is we talk to the residents about this important issue and how, this was definitely a tragedy in their family and a situation that a lot of residents of Monterey County went through. And we're really trying to provide this resource as a respite to them, to provide them that service. So I see Nick has his hand up.
Go ahead, Nick.
Yeah, no, I thank you, Daniel, for recognizing me. Yeah, I want to make sure our friends in the media know that all the information that we have available about this program is in English and Spanish. We have it on our website. We've been broadcasting it on social media, and we've shared the information with about 135 community-based organizations, churches, nonprofits, schools, systems, and other community leaders to try to get the word out. And, if we're able to get, some help from the media, that'd be great, because we do want, as Daniel said, we want to help the families. This has been set aside. Our elected officials have set this money aside to support our residents that are most in need and most vulnerable financially. The final note is that if one of the funeral homes in town happens to see this broadcast of this press briefing, who those people might be as well. And so the funeral homes are also a resource to get this word out to the families. So any support we can get from our media partners, we would be eternally grateful, because it is for the community.
And Nick, I just want to add, because a lot of people have questions about what expenses are actually covered under the program, right? So if there are funeral expenses directly related to the services, the funeral services, cremation, transportation of the decedent, or burial plot, cremation plot, the headstone, religious services, the funeral ceremony itself. If there's any other equipment that was utilized for the funeral service, costs for death certificates, and any other expenses that are additional that are required by law for funeral expenses, all of that could be covered under this program. So if hopefully this message gets out, we're going to continue our social media blasts, or I know that we're working with the different radio stations in Spanish to make sure that residents are receiving the message. So hopefully we get a last push before the program ends on October 1st.
Daniel, let me ask you one more question. The county set aside money for this, and at this point we haven't used it. But I think you would agree that doesn't mean the program is a failure. This really was a safety net for residents who might not have any other recourse. And what we're doing now is making sure that those who are eligible for this can really get this assistance before that money is moved to other purposes.
That is correct. I mean, this definitely is a service to the community. This is something that the county put towards the most vulnerable residents in our county. The circumstances, and that's, it's beyond the work that we're doing. So we're really, I guess on our end, what we're trying to do is just make sure that the message is out there and the community has the information. And so, like you said, if we can't use these resources to cover some of these needs, we're gonna make sure that those resources are used in a way that could still benefit these vulnerable communities in different ways. So the money is essentially going to other repurposed, if we don't have any other applicants, it's going to be repurposed for other programs and services for these very, the same underserved communities. So hopefully we can get some people in before the closure of the program, but if not, the resources will be utilized for other programs instead.
And if there are any questions for Daniel, please go ahead and ask them or put them in chat. We are going to ask Daniel to give the same information in Spanish for our Spanish language media. Victor, you have a question.
Yes, I do, Victor Guzman, KION, and Telemundo. So how much funding, I guess, was set aside for the program? I forget, it's obviously been a while since this first brought up, but how much funding was used, or how much funding was set aside? How much was actually used? Like how many people applied and were accepted for getting these services?
So for the Monterey County Funeral Assistance Program, we had a total of $500,000 that were set aside specifically for this program. To date, we have had, since we started at the end of last year in October, we've had 18 applicants that have tried to utilize the service. Out of those 18, 16 were referred to FEMA because they were eligible for FEMA services. 2 were eligible, but unfortunately were not able to provide documentation. When I say eligible, they met the criteria to move forward in the process. When we got to the point of asking them for some of the documentation and the receipts and the proof of the expenses, that's when we ran into some issues. And unfortunately, one of the cases, was not able to provide any information, and so we had to close it. The other one just ended contact as soon as we asked them for additional documentation. We tried to follow up with them several times, and we could not get them. So out of the total 18, 2 only were able to move forward with the process, but we have not. They did not follow through completely with the process, so we have not utilized any funds for the program or dispersed any payments at this point.
Victor, for Telemundo, would you like this information in Spanish?
Absolutely.
Sure.
Yeah,
Daniel,
KS.
take it away.
Ok, bueno, voy a cambiar al español. Para este programa, el condado puso una cantidad de $500,000 para cubrir gastos funerarios para personas que hayan sufrido gastos por alguna pérdida de familiares que hayan fallecido por COVID-19. La fecha de inicio de este programa fue a finales de octubre del año pasado, pero cubre gastos que hayan sucedido del 20 de enero del 2020 en adelante hasta la fecha. Entonces, si hay personas que aún en estos días hayan incurrido en gastos por funerales por COVID-19, pueden presentar su solicitud. El programa va a finalizar el 1 de octubre. Entonces, estamos nosotros tratando de hacer llegar este mensaje a la comunidad para que los que necesiten aplicar o tengan la elegibilidad para aplicar para nuestro programa lo hagan y tomen ventaja de este servicio. Lo que le comentaba en inglés antes de empezar en español es que hemos estado haciendo una labor de conexión o enlace comunitario tremenda para asegurarnos de que los residentes reciban el mensaje. Lo hemos hecho a través de entrevistas por la televisión, lo hemos hecho a través de estos mensajes con los medios de comunicación, la radio. Tenemos trabajo ahorita que estamos haciendo con diferentes estaciones de radio de diferentes grupos mediáticos en los cuales estamos enviando el mensaje a la comunidad. Lamentablemente solo hemos tenido 18 personas que han aplicado para este programa, de las cuales 16 fueron referidas al programa de FEMA porque eran elegibles para ese programa, y 2 personas que pudieron o inicialmente fueron elegibles y después no cumplieron con los siguientes requisitos que necesitábamos. Entonces, a la fecha no hemos desembolsado ningún recurso de esta cantidad que se puso para este programa, y estamos buscando la forma de que estos fondos sean utilizados en un programa. Si de aquí al 1 de octubre no tenemos nuevas aplicaciones, Estos recursos se van a poner en otro programa para ayudar a las comunidades vulnerables de nuestro condado, que sabemos que hay mucha necesidad en este momento.
Any questions, final questions, Victor, from Telemundo?
Actually had a general one regarding and you know what, it just slipped my mind. I'm sorry, give me a little bit. But was there outreach done in, I'm assuming there was some outreach done that showed that there was some sort of interest in a program like this that helped those that were undocumented. So I guess I don't know where did it come to a point where we couldn't quite fund?
Yeah, Daniel, you might want to take away how the genesis of the program.
So the outreach that, I mean, we've pretty much done outreach throughout all the county. We utilize the VITA workers to do pretty much outreach from south to north of the county. We went all the way down to San Nardo, San Lucas, King City, Greenfield, Soledad, and then all the way up to Salinas and the north counties, Castroville, Pájaro, Las Lomas, going in some instances door to door, participating in the food bank deliveries, distributing materials with residents. We've really, I mean, radio shows, radio interviews, spots on the air. It's been quite an undertaking in terms of the outreach that we've been doing throughout the community to make sure that residents have the information. I really, in terms of the expectation of the participation has been low. We can't deny that. Now, the reason for that, I don't have a clear, response for that, because we've tried to make it clear that this resource is meant to benefit those who are most, or ineligible for these programs. And I mean, in terms of the outreach that's been done, this is, of course, we assess the need when this program was instated. We knew that there were going to be residents that were, especially because during COVID, some of the areas that were hardest hit by the pandemic were areas where a lot of the farm workers were residing. So we knew that this was a program that was going to, seek out that assistance for these residents that we knew were going to be vulnerable. The response, for some reason, I can't explain what the reason for that lack of participation has been. But we have to keep trying. We have to keep trying to push out the message. Have to keep trying to make sure that residents understand that they can apply for these resources, for this service, up until October 1st, because that's when we have the cutoff date for that program.
Sure. Is there any sense, and in public health, it doesn't look like it doesn't look like they're in the meeting, but is there any sense of how many undocumented people in Monterey County died of COVID?
I think more of the data was on by industry, by age. I think you might be able to, it's possible you could extrapolate some information from the work, who was working, during that time and who was vulnerable and at risk.
I see Karen
There's Karen.
unlocked her video, so maybe Karen could share a little bit. But yeah, I don't know that they were tracking if a person was undocumented when they passed. I don't think that's something the hospitals track.
It's been a while since I looked at it too. So.
Yeah.
No, I don't believe we did. I believe it was race, gender, occupation, and age, and area in the county that you lived. So if you look at the numbers, that's what you'll get. But I don't believe it was ever, that's not something we in health that we ask.
And I don't think it was a requirement. I mean, in terms of receiving services, or that was something that was looked into. So
no, if you're sick, and you need help,
yeah.
Especially during a pandemic.
Any other questions for Daniel or Karen, who's here?
I guess, how many funeral homes are we talking that, maybe could help you guys out? Is there any sense of that in our county that could potentially say, hey, we had this group that was undocumented that came in, they said someone died of COVID, they didn't have the funding, or they were having trouble paying for expenses. Is there any sense of that? Just the scope that we're dealing with for this outreach that on our part we're trying to do here too.
I can try to address that, Victor. So obviously there's one independently owned funeral home here in Monterey County, which is Struve and Laporte, and they also own Alta Vista which is on Alice South Street. The other funeral homes in the county are owned by, there's an organization called Dignity that owns one in Monterey, and they'll have other branches throughout South. I think even the King City one is owned by one of the corporate organizations that have, there's an office in Seaside as well. So we don't have an abundance of funeral homes in Monterey County. There's probably about half a dozen in the county as well. So, and of course, there's another one in East Salinas. And right now the name's escaping me, but they had been bought out by another corporation. But we can get that information to you. I have contact that I can get that information for you.
And I do have a question, and this would be for Karen. So surprise, Karen. How is the COVID situation now in the county? And perhaps you can, you check the daily data.
I don't have access to the daily data, so I can't speak to that. I do know that nationwide and statewide, we're seeing an increase in excuse the garbage can in the background. We are seeing an increase in cases of the new strain. But specifically for Monterey County, I can't say that this fall is going to be complicated, just because the COVID recommendations will come out in September. We have flu, and then new on the market is a vaccine for RSV, which is aimed at infants and adults. All three of those are respiratory illnesses. So it's going to be complicated, but I don't have anything exact for the area.
Victor, you have a question.
Yeah, and this is just my ignorance and curiosity. I think the last booster I got was the second one. What booster are we on at this point? Do you have to kind of go through those steps for the third booster, then I think it's the fourth or fifth one? What's that process at this point?
This is where it gets complicated. So the governing body that recommends, and the FDA and the CDC, who they'll work together for the recommendations. We expect to hear from them at the end of September. It is unclear whether those boosters are going to be, the new booster is going to be for adults over 65 and people with, we don't really know. So we can't speak to that. We can, for right now, until we have that, it's stay up to date based on what your healthcare provider says. And I
it could be also take the booster that's available to you, correct?
Yeah, and yes, take the booster. And if you haven't been vaccinated, because we do have people who aren't vaccinated, get vaccinated is the message for that. And I'll get my flu plug in here too. Flu season will be upon us before you know it. There's flu vaccine in the community currently at a lot of the pharmacies and some healthcare providers. So I would say get your flu vaccine as well. And keep an eye out for some community clinics. I do not have the schedule in front of me, but they will be coming.
Any last questions on the funeral assistance program, on COVID, on flu?
Maybe I can share just a little bit. I have a flyer here that we were using to distribute. I have it here. I have it in English and in Spanish, but I'm going to share the English one. Do I have sharing privileges?
Sure. Please. And for those that were asking about the funeral homes, it's in the chat.
Can you guys see
You make it a little larger.
Oh, let me
change the view. It's good.
Yeah. No. Nope. Sorry.
Getting into the weeds there.
I know. I went to a different page now. Sorry.
Let's make a whole new one.
I'm just gonna open it again. There we go. Let me share it again. Okay, there you go. Oh, this is the one we did for the Spanish. It's the same information, but in Spanish. And this is what was being distributed throughout the community with the residents in the different events that the health department and the VITA workers, when they were distributing information, this is what was being distributed. So it's pretty clear as to what you needed to bring and what you needed to provide to be able to show that you qualify for the program. So hopefully, hopefully we get some more people to reach out and to try to access the service. And that's kind of why we want your help to let us send out this message. So thank you.
Yeah, and Daniel, I also sent it to all our media in our area, so they did get it via email. I'd be happy to send it again if they can reach out to me.
Thank you.
We'll do, Daniel, if you would share those with me, we'll do a follow-up for the briefing.
Yes.
We'll go out with all the data that we have, and we'll get Karen to give us a look for flu shots and what else is coming up. Any last questions for today? Seeing none, thanks everyone for a really interesting and robust news briefing. Our next briefing is next week, and we'll see you then.
Thank you.